All right. Hey, everybody. It's Allan Acton from Cary Family Dental, and I'm here with Dr. Brian Coan. He is the founder of Care Plastic Surgery in Cary, North Carolina. He is a double board certified plastic and reconstructive surgeon. He is Duke trained and widely respected for his skill in procedures like facelifts, eyelid surgery, rhinoplasty, breast augmentation, tummy tucks, and body contouring. For more than 20 years, Dr. Coan has helped patients look and feel their best, not by changing who they are, but by restoring confidence through natural, authentic results. Today we're going to talk about the art and science behind great plastic surgery, how he approaches patient care, and what it takes to build a practice centered on compassion and excellence. Welcome, Brian. It's exciting to have you here today. Yeah.
Alan, thank you so much for having me. I've been looking forward to this conversation for some time. It's good to be among like-minded physicians, helping each of our patients achieve their very best.
Yeah, you and I have known each other kind of for a long time. We both started our practices here in Cary, and I remember when you were building your building, and I drove by it kind of in one of the same times that we were driving, that we were building ours, and I drove by and I was like, I didn't know it was you, and I drove in, I took pictures, and we stole some of your concepts that you had there. It was such a neat time.
We shared some of those concepts. It was gladly given.
Exactly. Thank you. So before we start talking about your practice, I'm kind of interested in, like, how does somebody get into becoming a plastic surgeon? What was it that was like, I mean, had you always wanted to do it? I had been pre-med when I was in college, and then I went a different path, becoming a dentist. But like, what was it that drew you to plastics? Was it early on in your career, or early on in your training, or was it later on once you got?
It's a question that I get a lot, and I wish there was a preordained plan. There really wasn't. I've always sort of stayed in the moment, focused on being the best at what I was doing in the moment, and opportunities presented themselves. Going all the way back to my childhood, I did know that I wanted to be a surgeon. That had been preordained, and I tried really hard in medical school to find something that attracted me other than surgery, and nothing did. Having been at MIT and studying mechanical engineering, knowing that I wanted to be a surgeon, the natural tendency, everybody thought I was going to be an orthopedic surgeon, and I really expected that and thought that was the pathway in front of me until I actually got exposure and interest in orthopedics. And it really wasn't diverse enough for me. I was really interested in the whole patient. I was really interested in interpersonal stuff and long-term relationships with my patients. I really like physiology. And coming out of medical school, the next most logical choice for me was general surgery. It really was the whole patient experience. It was really a just broad breadth of knowledge of understanding every biological system. Neurosurgery is part of the training, all the way down to general, GI, cancer, adrenal. We did all of that, trauma. And as I was finishing my training in general surgery, I did that in Texas at UT Southwestern. My mentors were all asking me what my specialty would be, and I was kind of taken aback. I was like, well, I want to be a generalist. Isn't that why I'm here? And they said, no, you should know that's not really how general surgery is practiced anymore. Unless you're going to live in a town of 30,000 people, you really got to specialize. And I honestly went through a moment of, what am I going to do? And then I kind of, it hit me. Wow, I had this rotation as an intern where I was on the plastics service. And these guys helped everybody. They literally were taken care of, and the senior surgeon used to brag about being a plastic surgeon was to be operating on the skin and its contents, meaning they literally were everywhere. And I said, well, that's what I thought general surgery was all about. Apparently, I need to be a plastic surgeon. And so I asked my program director if I could spend some time with the plastic surgeons, and he said no. I said, I really want to do this. And he says, why would you want to be a making it bigger, making it smaller surgeon? And he was really against the idea. And I said, I don't even know what you're talking about. I've seen facial reconstruction and breast reconstruction and limb salvage and hand surgery and craniofacial. I want to do that. These guys are amazing. And then I went back to him, and he was a vascular surgeon. I said, and oh, by the way, they do microsurgery. It's amazing. They can put all these stitches in a 1 or 2 millimeter blood vessel. That's the most extraordinary thing. Now, he was a vascular surgeon, and I think that high level of sophistication appealed to him, and he let me rotate on to plastic surgery, and I ultimately declared that was what I wanted to do. And after making application, I was accepted into the Duke Fellowship Program, and I did that in 2005 to 8. And it was a microsurgical powerhouse, and I just loved it. We really, truly were not afraid to take on any challenge, and it was really the culmination of plastic surgery and engineering. When I think about the mechanical engineering toolkit, which is, we have a problem, these are the tools, come up with a unique and creative solution, it was everything I ever wanted. And I loved the idea of, you're learning these plastic surgery tools, and can you bring them to bear to solve a unique, and every patient is unique. So we would have meetings and talk about this unusual cancer resection or trauma, and how are we going to go about using the tools that we had to, help restore somebody's face or their anatomy or their ability to eat or swallow or speak. All of these things were a part of the toolkit, and I absolutely loved it. And when I finished plastic surgery training, I thought I was going to be a microsurgical limb salvage doctor, but ultimately fell in love with some of the meticulous practice of aesthetic medicine. And the natural tendency was to try to do everything. And I quickly figured out, and this is the business decision, that I can't do everything. I needed to focus on one arm of the practice, be it reconstructive or aesthetic. And I turned out to be pretty good at aesthetic medicine. A lot of patients were coming to me and asking for aesthetic procedures. And I was driving all the way to Alamance County to be the sole reconstructive surgeon over there. And ultimately, I just couldn't do everything. And my practice is now a 100% cosmetic practice.
That is awesome. That's a great story. How long was your fellowship at Duke? Like, how long did it take you to go from general surgery and finish the plastics part of that?
I kind of joke, it's the remedial program. So I did 4 years of undergrad at MIT. I did 4 years of medical school, that's 8 years. I then did 5 years of general surgery training in Dallas, Texas, and then I did another 3 years of plastic surgery. So 16 years total of training to be board certified in both general surgery and plastic surgery. There are some shorter pathways that are available now and are more common, but that was pretty much the way to do it when I did it.
That's incredible. Like, it's really neat. And to be able to see, even on Instagram sometimes we'll see these plastic surgery cases that are before and after, and you're just like, that's amazing what can be done. But for those who may not, like, they sort of understand the idea of plastic surgeon, but like don't understand the breadth and depth of some of the things that you do. Can you talk a little bit about, like, what are some of the things that you see on a monthly basis? Like, what kind of things are people coming to see you for?
So common things are common, and the most common things that I hear about and patients request are, parts of daily living. Women who've had children, women who've lost weight, men who've gotten in shape and want to take care of extra skin. So the most common things are, the effects of life and aging, and people wanting to restore and rejuvenate and return their bodies to the best that they can be. And there are limits to what we can do with, diet, exercise, and taking care of our bodies. And I hear it so often from women, gosh, I was told that if I only exercised, I would be able to get rid of this extra skin, or can I just try for another, couple months to try to get rid of skin. Doesn't go away with exercise. And, for the person who's really worked hard, the most common things I see are breast lifts, breast rejuvenation, augmentations, tummy tucks, liposuction. Those are common. And then, of course, as my practice has aged, my patients have aged, and I see a fair amount of facelift and blepharoplasty and eyelid rejuvenation as well.
Sure. We talked a little bit about before we hit record. People don't come to you specifically for that procedure. big picture, right? They come to you, and they come to me too when we're talking about smile makeovers or body makeovers or mommy makeover. They're really coming for a change in the way they feel about themselves.
Totally.
And I don't know how it is for you, but for me, like if I can take somebody who's unhappy with their smile and maybe they don't smile in family pictures, or maybe they hide their smile, or they're like, no, I don't want to be in that group shot, I'll just take the picture. And then you can take somebody and you take their smile, and for us it can be in as few as 3 weeks. You can take them and now they've got a new smile that they're confident with, and now they can go out into public, and it changes the way they interact with the world.
Changes
so you know what I mean, like, and so now they smile more at work, and then they're more excited, and they have a different affect to the world, and now people perceive them to be a little bit different. So I mean, for me, and I'd be interested to see like maybe how it is for you, but for me, it's like in my little corner of the world, I'm making a small difference in the world by making people feel more confident and giving them more confidence as they go out into the world. Tell me a little bit about how you feel about that, and am I on target?
Totally, yeah. So there's actually 2 times that I kind of like try to tap into that. And obviously when somebody first meets me, I want to know what it is they're trying to achieve. It's definitely a reframe that I try to do early on in the conversation. You're not really there for a facelift. You're not really there for a breast lift or a breast augmentation. There's something that you want as a result of that procedure. And the typical answer is, I want to be happy. Well, okay, but why? What's going to make you happy about that?
Right.
And what do you see that because I don't have a happy wand, I have a scalpel and I can achieve certain things. So we get really objective about it to try to figure out what it is that they see, and can I, make the changes and deliver. And so I get very objective and really want to talk about the specifics about what their outcome is that they're really looking for, because I have a really good idea about what I can deliver. But then the second time that comes up in conversation is actually far more meaningful to me. And I love to ask people at their 3-month or 1-year follow-up, and you can see it when they walk in the door. They're very happy. They're very excited to see me. But I want to ask them, how did this show up for them? Like, how did the results show up? And I hear all kinds of things from, new love, new job, new friendships, new experiences, trialing new things, wearing new clothes, confidence, a new job. I mean, there's just so many secondary, and you feel like you've unleashed a patient, and released them to their capacity and capabilities. And I mean, I just want to be a part of that team, hey, I'm here to serve that and, get you on your way. I want to see what people can go out in the world and do.
I mean, I think it's great. I mean, it's a unique thing to be able to do that. I mean, before I went to dental school, I worked for a credit card company, and I'm like, I am not making a big difference in this world. I need to go out there and do something that's making a difference. And it's fun. There aren't a ton of jobs where every day you can see the impact that you're having on that personal level that you're having, which is really cool. What talk to me a little bit about like some simple procedures that somebody can come and do that they're like, all right, I just need to get a little bit something done. I mean, people might not even, like I saw on your website, it must be 75 different procedures that you can do, right? I don't know, something like that, right? And you've got some great before and afters on there. I think people should go check that out. But like, if I'm, hey, I'm not feeling so confident about my body or my face, like, what are some things that I could do maybe from a scale of like 1 or 2, like up to like 10? Like maybe I just want to dip my toe in the water a little bit on making some changes at first, just so I get to kind of understand the idea, and then maybe there's some bigger things that we could do. Does that make sense? Yeah.
Yeah, absolutely.
Yeah.
So my personal approach is I have to meet patients where they're at. And it starts with, I have highly educated patients who have a clear idea about what the next step is and the next thing they want to work on. They've got a lot of experience and have done a lot of research. And then I have patients who have never done anything and have just, wondering and maybe they know the specific thing they want to fix, but they don't even know how that would go about doing that. And then I have patients who really want to put themselves completely, and again, this is the hardest patient actually, is the one who just says, what would you do? I hate that because
I know. I get
honestly, the end of the day, that takes a tremendous amount of mind reading, and
it. Yeah.
I'm not a mind reader. I want to actually serve the patient and figure out what it is they want. So I'd really like to tease that out. So balancing the patient's goals, you're right. There are, gosh, the number of procedures that I offer is extremely broad, and we do some minimally invasive procedures, things that are going to have limited longevity or a limited, transformative, but sometimes that's all somebody needs. They may have a lot of anxiety and just want to try something small to know that they've taken care of this little thing that bothers them. So I try to map that out. The best patients are ones that want to have a long-term relationship too and say, hey, I know that I'm aging. I want to support myself. I'm doing the best to maintain my health. And what can we do to help me along that process? That's typically the process that I go
So
through.
walk me through that journey a little bit. Let's say that person wants to become a long-term patient of yours, wants to maybe start, I don't know, when do people start? In their 40s, their 50s, or even earlier, I don't know, right? And then are you looking at procedures that they can get started in their 40s and 50s and then maybe say, hey, okay, in 10 years we're going to do something else and then something else beyond that? Walk me through maybe a patient journey of somebody that you can think of.
So the most common the most common patients in plastic surgery in general are women. They do account for probably 80% of the patient population, but men do choose to have cosmetic procedures, and I have a fair number of men in my practice as well. But I'll speak to the women because they tend to be the more common patients. The most common thing that a woman wants to talk about is restoring their bodies after childbearing. So women pre-childbearing maybe developed breasts that are too small or are not proportional, and that's a very straightforward procedure, a breast augmentation. Sometimes the breasts are not symmetric or develop very rapidly or too large, so I might talk to somebody who's pre-childbearing and wants a lift or a reduction. And sometimes I have patients who are, again, I'm talking about patients in their 20s to 30s. They will come and seek out things like liposuction and body contouring. So that category of younger women who haven't had children, extremely common in a very, very substantial portion of my practice. The next category in terms of age is somebody who's had children and is done with children, or, and again, very similar patient population, patients who've lost weight and gotten healthy for whatever reason. Either it was because they had pregnancies and then lost the weight, or gained weight, as many Americans do, and then figure out, wow, I really need to get control over my health, and they lose the weight and want to get their body back. Those patients have a similar pathway, and that typically is something like a mommy makeover. And the most common combination would be some form of breast rejuvenation, either adding volume or taking volume away, a lift to restore shape, and a tummy tuck, an abdominoplasty. I do all of that at the same time, sometimes with liposuction, sometimes with labiaplasty, sometimes with additional add-on procedures like facial resurfacing. But all of that can be done at the same time very safely. And quite frequently, that patient then becomes a patient for life, but not for surgery. They then want to maintain and do skin resurfacing and do Botox and fillers. When you transform somebody's life like that and they trusted you for that, they want to do the smaller stuff with you as well. On the flip side, I got patients who've started and dabbled with Botox and fillers and facial resurfacing, and ultimately then decide to take the step into the journey and have a surgical procedure like a breast enhancement or an abdominoplasty.
Okay. All right. So just out of curiosity, for a mommy makeover, how long would that take somebody to maybe say start feeling okay again, like recover in the first few days, and then to where they are looking back to the way they wanted to? What's the timeline there?
Yeah, the timeline. First of all, recovery is a tricky thing. So everybody has their own milestone of what they want to know. When am I going to stop taking pain medicine? Yep. When am I going to be able to exercise? When am I going to be able to hit the gym? And again, I typically will give all of those things, but first of all, it is always easier than people think it is. When I tell people again and again, this is how we do it in my practice, this is what the experience is, for a massive mommy makeover where we truly do everything, you can expect to take pain medicine for anything between 5 to 7 days, sometimes 10, but feel like you're over the hump within 10 days to 2 weeks, and be back in the gym exercising by 6 weeks. And most people who are at desk jobs go back to a desk job at about 2 weeks. So it's taking 2 weeks off of work for a big surgery. Most people expect that. And then what I tell people is everybody can objectively look at their results at 6 weeks and be pretty happy. But you still feel like you had a surgery at 6 weeks. You still are getting used to, especially if we've done a number of transformations, you still wake up every day and go, wow, I don't remember how awesome this is. You get it, getting used to it. And speaking to a dentist, I often actually reference what it's like to go to a dentist, because many patients actually know the proprioception of a filling. And when you have a filling and the dentist puts in this brand new filling and you go, hey doc, it feels kind of odd. This change of your tooth, because you know your tooth intimately. Your brain has a map of every nook and cranny. That's why a poppy seed feels so huge. Plastic surgery is the same way. I'm literally going to make a change, and it takes time to get used to that the same way it would to get used to a new nook or cranny in your teeth. And what I tell patients is that between 6 weeks when you're in the gym and life is great, it takes typically about 3 months to forget that we did surgery and to really be kind of past all of that and just be 100%, this is the new me and this amazing. So at 3 months, everybody's already planning their next thing. If there's another step to go along, they're already excited about the next thing.
All right, that's a good answer. All right, you must get, and I know I do, you must get some of the same questions every day, right? So people coming to you and they have a lot of the same questions. What are some of the common questions that people will ask you that you want to maybe use this forum to say, all right, here's some of the things we can go ahead and answer for you?
I gotta think about that. The common questions. I think people have fear over things, and I guess I would break down those into 3 categories. I'll either get questions about, am I going to look, or is he going to understand what I want to look like? And I have people who are very focused on, are they going to get the outcome that they imagine? And I think it's really important to get objective. And the example I can give for that is when somebody says, I want pretty breasts, I have no idea what that means, right? Because your idea of pretty and my idea of pretty may not be the same thing. So we have to really learn to communicate. And so one set of questions I get is, what am I going to look like? And I really, really work hard to communicate that effectively. So that's just truly important to me. The second set of questions I get are process and immediate recovery questions. Patients who are scared about anesthesia, scared about pain, and those questions are really understandable in that most people, many of them are healthy and have never had an anesthesia, and so or never had a surgery, and so they think it's going to be painful and that they're going to have to, forgive me, bite the bullet,
Right, yeah.
Grin and bear it. Or that they're going to just have to be miserable, or they heard for a while that it's going to be this awful thing, but we have to get through it and it'll be worth it. I've never told a patient that, and in fact, that's quite the opposite. So that's a myth that I have to often debunk right up front. Is that plastic surgery doesn't have to be painful, doesn't have to be miserable, and if it is, I should get a phone call. And fortunately, I don't get those phone calls, so we do a really good job of taking care of what that immediate post-op is like. And the third set of questions often come from my accountants and my planners and my very meticulous patients. They're worried about long-term. I get patients, who are long-term planners, and they want to know, if I'm getting an implant, what do I have to think about in 15 years? By the way, implants are extremely safe, the most trusted devices, and the good news is there's very little that you have to think about in 15 years. They want to know, will I be able to breastfeed in the future if they're a young woman, or will I have to do this again? Those are some of the sort of long-term questions that I get from the planning-minded the patient who's always thinking about the future.
Yeah, that's great. All right, so we also talked before we hit record on that you were a patient, not a plastic surgery patient, but a dental patient, and you had some long-term issues that you'd been dealing with really since you were a child, and we sort of we talked a little bit about how I got the sense that it helped you create a connection with your own patients.
Sure.
On some of the things that they were going through.
For sure.
I'd love to hear a little bit more about that.
That it was very personal, and I don't mind sharing. I share with my patients, and in fact, for a while I wore braces, and it created a remarkable connection with my patients who were there for whatever they were there for. They were like, "You're wearing braces, ha ha ha," and I said, "Yeah, I want to improve myself just like you do." It's like there's a thing that I can fix, and I want to fix it. And when I reached the finish line, and I had it was a lifelong process. I was missing some adult teeth. I had worn a fake tooth. At one point, I was told it would be very difficult, and more tragic was at one point, it popped out. And I thought, hell, how am I going to go to work with a missing front tooth? Like, hey, I'm your plastic surgeon with a missing front tooth. And then I met a dentist who was able to, give me a temporary fix and give me a long-term plan. And when I got to my finish line after braces and implants and could smile, like never thinking about a missing tooth again, I mean, it was life-changing. It was life-changing, and it was my smile. And some people would think that's nothing. I know you don't think that, but for me, it really opened my eyes for even what my patients were experiencing. And again, I've had surgery too, and I know what it's like to be under anesthesia and what the anxiety is for that. But for a cosmetic problem like a smile to be as minor as that was, for me, it was the biggest deal. And it totally changed my life. I love biting into an apple and smiling and chewing and putting my teeth together and showing, this is what I got. It's great.
It's so many times it's not about what other people see about us, it's what we see about ourselves when we look in the mirror. It can be something as small as having a chipped tooth, and they won't even go to work. They'll show up before we even open, and they'll wait there on their chipped front tooth for me to fix it before they'll even go to work. We can all sort of relate to having a bad hair day. Even imagine that. You're like, I just don't feel like myself. And you can fix a hair, you can fix a tooth, but for what you're doing, you're taking somebody and you're really transforming the way they look, and you're giving them a whole new sense of self. And I really think that's amazing. And I think, so much of what you're doing is magic in some ways, and you're dealing with the sort of the biology and the physicality of it all, but you're dealing with the psychology of it.
There's a lot of that.
At the same time. There's a lot of psychology.
It's the best part, because that's people, taking care of people and being able to follow up with them and get to know them and hear about how they're back at their horse farm, or they're out and about dating again. Or, it really is transformative, and it makes people very happy. But back to the dentistry part, the one other thing I would say about that is, there are a lot of nerve endings in the mouth. So a chipped tooth is a big deal. You're very aware of that. And, that problem could feel this big to that person. So that's understandable.
Yeah, that's great. I really appreciate your time. You've been awesome. I've learned a ton. Are there other things that you want people to know? Like, anything else you'd want them to know, or maybe where people can find you as well?
Sure. Well, I'm right here in Cary. We're centrally located. I like to say that we're near the airport because people in Raleigh sometimes get a little nervous. But we're right off Harrison Avenue and Weston Parkway. One of the things that I'm very proud of is that I built a facility here where I knew that we could control everything. I have my own fully accredited operating suite with 2 operating rooms, and a full team that's dedicated to all things aesthetic, including a medical spa where we do laser and resurfacing and skincare and facials and cool sculpting, non-invasive treatments that can really make a difference. And then I have my operating suite, and my surgical experience there is, the skin and its contents. I still love to do everything from rhinoplasty and breast enhancement to liposuction and tummy tucks and mommy makeovers. You can find us online at careplasticsurgery.com. I have an extraordinary team that I'm proud of. I go out of my way to train them about and cross-train them about the things that each of us is doing to enhance a patient's experience. And hopefully many of the people that you encounter on the phone are going to be able to answer a lot of your questions. So I encourage people not to be shy. If there's something that they're wondering about, we would love to talk to you and help you develop a plan. COVID was actually a really useful time and an innovative time for us. We really mastered the art of the digital consultation. And so some patients get a little bit put off by it, but we ask patients who are really interested to upload photos. We have a proprietary and HIPAA-compliant secure portal where you can upload photos, and those photos are reviewed by me. So we'll be able to give you a really good idea of what we would prepare for you and talk to you about, and give you a lot of information before you ever come to the office about financial expectations, recovery, downtime, and try to get a strategic plan in place. So we really have tried to take a lot of the barriers out of the way and make it as easy for you to solve your aesthetic personal needs as possible.
That's great. You have a beautiful facility, and so when somebody comes for their first visit, so they want to do a consultation with you, how long is that consultation?
Typically an hour.
Typically an hour, okay. And then if they wanted to get started on something, how quickly does it take to once they get
depending on the size of the procedure, we could get you scheduled within 2 weeks, but maybe as long out as 6 to 8. But people don't like to wait too long, and we do our best to try to accommodate. But sometimes longer procedures require a little bit of planning and scheduling for the patient. And so we try to accommodate that as well. And for instance, we're about to enter the December and November time when there's a lot of vacation time, and those time slots tend to book up, back in June. So we have a lot of patients who have a lot of foresight and say, oh, during my vacation time, I'm going to get my procedure done in December.
Okay. Yes, we're familiar with the busy December times.
Yeah.
This has been awesome. I've learned a ton, and I hope everybody else has too. I really appreciate you taking this time. I know it's a busy Friday afternoon and you've got other things to do, but this has been incredibly instructive, and I look forward to seeing you again soon.
I really appreciate talking to you. I love what we do and helping people achieve their very best. Allan, thank you for bringing me on your show. I really enjoyed it.
Yeah, I love it.
Awesome.
All right, I'll talk to you soon.